I'm Tanya from Advanced Dental Artistry. Today we're going to talk about back teeth. When a patient comes into the practice, we have a look at the back teeth to see as to whether there's any decay in the grooves or underneath existing restorations. We want to make sure that there's no decay in the tooth. The other thing that we want to look at is whether there's a tooth that has a very large restoration. A lot of our patients come in and they have old silver fillings, or what they call amalgam fillings. These silver fillings were great material 30 to 40 years ago, but now materials have changed. The silver fillings are made out of metal, and with metal they expand and contract with temperatures. So if you have a silver filling in your mouth, when you have something hot to drink, it micro-expands. If you have something cold to drink, it micro-contracts. If this happens, it's in a tooth structure that doesn't have that flexibility. What it can contribute to is fractures in the tooth. Often these fractures are vertical fracture lines. They go down the tooth. Unfortunately, when you take an X-ray is taken from the side of the tooth, so you cannot see these fracture lines in an X-ray. With these vertical fractures, we just don't know how far they go. They could go part way through the tooth, or they could eventually go all the way through the tooth. If we can see that a silver filling has some fracture lines in it, it may mean just replacing the tooth-coloured filling, or it sometimes may mean if the fracture line goes extensively through the tooth, that we may recommend to do something that covers over the top of the tooth. The reason why we would recommend this is by covering something over the top of the tooth, it's like putting a helmet on a head. It kind of protects the whole tooth. It brings the whole tooth together. So when you bite down, the tooth isn't going to flex. So it decreases the chance of the whole tooth fracturing in half. In worst case scenarios, the tooth can fracture in half. And if that's the case, unfortunately, there's nothing we can do, and it is sort of extracting the tooth. So whenever a patient comes in, we just want to have a look at the long term, especially back teeth. Back teeth can take up to 10 kilograms of force. So we want to make sure that a patient is going to come in and something fractures off, or the whole tooth fractures in half. Whenever we look at doing an examination, sure, we want to make sure that there's no decay in the tooth, but we also want to make sure that a patient's not going to come in and something's going to fracture, that we look at the long term of the tooth, where the patient's going to be in sort of 2 years' time, in 5 years' time, and in 10 years' time. I hope I explained everything a little bit to do about back teeth and what we sort of look at. If you'd like to give us a call on 1-800-SMILEY, we look forward to seeing you soon.